Dr. Ron Kneebone is a professor of economics and director of economic and social policy in the School of Public Policy, both at the University of Calgary. In his published research, he has examined the characteristics of Canadian government, fiscal, health, and social policy choices. For the past few years, he has been learning from others about the complex problem of homelessness and has sought to bring the perspectives of an economist to the problem. And I'll stop there. We were fortunate to have him expand our minds this morning, and so I'm really looking forward to part 2 of that. So thanks.
Thank you. Oops. Okay. You switched technology on me. Okay. Thank you for having me back. I'm glad. I'm really anxious to present this to you because this is new work that Rita and I are working on. Remember, I warned you this morning that I'm an economist, so prepare yourself. Well, Rita's an economist as well, so double prepare yourself. The red stuff in bold didn't mean to be so scary looking. It's just it's there because this is still preliminary stuff. So Rita's actually in Calgary right now redoing some of the calculations, so they might be changing, but I don't think they're changing terribly much. This one started with me doubting Rita because we had the long series you saw this morning of data for Calgary from 1992 to 2014. And she said, you know, another way of looking at this is rather than looking at a time series for one city, you could actually look at a number of cities at a point in time, what economists call a cross-section. And I said, sure you could, but I really don't think this is going to work. But she's pretty persistent, so she carried on, and she collected an enormous amount of data. Turned out she was right. So, way to go, Rita. Rita got married recently, and her last name changed from Gress, starts with a G, to Wilkins, starts with a W, which means her name goes after mine, because we always do it in alphabetical order. So she blew it by getting married. Otherwise she would have been first author. So what's this about? It's about shrinking it's about what public policymakers can do to shrink the need for homeless shelter beds. And so the data I'm going to present to you here, when you start showing it to you, is not the number of homeless people, but rather the number of shelter beds that have been provided. So the number of shelter beds provided per capita varies widely by province and city. So, for example, there are 128 shelter beds per 100,000 people provided in Alberta versus only 77 in Ontario. There are also differences by city. Calgary has twice as many shelter beds provided than Edmonton does. So the question is, why do some cities provide more beds than others? And in particular, and it must be important because it's in italics, are there policy choices that could be used to influence the need for shelter beds? And again, I'm not trying to understand why do we have homeless people. I'm trying to understand why do cities provide a certain number of shelter beds. Oops. So what Rita did is she collected data on 51 cities. The 51 cities across Canada who report as having provided emergency shelter beds. So we've got the full sample of all emergency shelter beds. And this is from 2011. And it comes from something called the National Household Survey that was published in 2011. So our goal is to identify the relationship between the number of shelter beds and policy-sensitive variables. So, you know, it's maybe some misguided economists can show you the relationship between homelessness and weather, but it's really not to the point. That's why I did this morning for those who were new. That's not really to the point. What we want to do is identify how sensitive is this measure to what policymakers can actually do, so that we can actually tell them, here are the levers that you need to push forward or backwards in order to make a difference. Okay, so people fall into homelessness for many reasons, as you know. I'm not telling you the news. But they can be broadly categorized as falling into homelessness for two big reasons. One is related to economic conditions and circumstances. You're simply poor, or you have an unstable income, something like that, or the cost of housing is so high that you can't afford. And the second broad reason is due to your own personal circumstances, whatever your own personal demons are, whether it's drug abuse or having a history of domestic violence or sexual abuse or something like that, your personal circumstances. Our focus is on number one. Read the slides, don't listen to me. Our focus is on category number one. The number, so what we're trying to look at are the number of shelter beds provided to people because they have come to a shelter for economic reasons. And Canadian studies have been very consistent in showing that roughly 2/3 of all shelter beds are provided to people because of economic need. They've come to the shelter because of an economic need, not due to their personal circumstances. I recognize their economic circumstances as part of their personal, but it's not because they're drug addicted or alcoholics or have some mental issues or anything like that. It's got to do with their economic conditions. So 2/3 of all shelter beds are provided to people who come to a shelter for just a couple of nights and then they're never seen again. Or maybe for a couple of nights this week or a couple of nights 30 weeks from now, but then they're never seen again. Okay, so I'm referring to the studies by Tim Aubrey and others, looked at Toronto and Ottawa and Guelph, and the studies that we did in Calgary showed the exact same thing, and a study done by Bernie Pauly and colleagues at Victoria showed the exact same thing. 2/3 of all shelter beds are generally provided to people who have short stays in shelters and are there because of economic circumstances. So these are the people I want to really talk about. And what I'm going to try to convince you of is that there are ways that we can keep these people from ever falling into a homeless shelter. And this will enable us to close a substantial number of shelter beds. And I'm going to actually give you some numbers, of course. Okay, so our focus is on housing availability, and the argument is pretty darn simple, isn't it? Even if one can pay for minimum quality housing, if there's nothing left over to pay for food and other necessities, you might naturally and rationally decide, instead of trying to pay for rent, I'll double up with relatives or friends, or maybe I'll try and stay in a homeless shelter. So the key here is, how much income do I have available after I pay for rent, if anything? I'm going to suggest to you sometimes the answer is actually negative amounts. Your income's not enough even to pay for rent. But even if you can pay the rent, if you don't have enough left over to pay for food and clothing and other necessities, which, by the way, just to be controversial, might include the drugs that you use because you're a drug addict, then you will choose instead to stay in a homeless shelter. So, the affordability of housing is determined by a great many factors, all of which feed into some measure of housing affordability. And you can think of things like interest rates clearly affects housing affordability. The rate of rent inflation clearly affects housing affordability. Social assistance income matters. Growth in earned income matters, whether it's growing fast enough relative to rents. Local government zoning, housing regulations, zoning laws, and density restrictions all affect the cost of building housing, and so affects the cost that you have to pay in order to be able to rent that housing. An enormous number of things all affect the price of housing and your ability to be able to afford to rent that housing. So what's key is that your level of income relative to the cost of housing. And it's important to emphasize that a lot of things come into play here, a lot of things. And in particular, every level of government, federal, provincial, and municipal, has a role to play in impacting these variables I'm going to show you. The federal government has a role to play. Bank of Canada determines interest rates. They have a role. The federal government affects taxes that we pay and some types of assistance that are provided. Certainly the province has a huge role to play for obvious reasons, but so does the local economy, as Councillor Henderson recognizes, that they also play a very important role in determining the affordability of housing. So everybody's on the hook here. Key explanatory variable then is, you saw, I talked about this morning, is your social assistance income paid by what's known as a single employable. And why am I choosing a single employable? Because that's someone defined by the social assistance program as a single employable. That's the person who's most likely to fall into homelessness and use a shelter. Remember, what I'm trying to get at is, why do certain cities offer so many, certain numbers of shelter beds? Okay, so I'm looking at the income of the poorest of the poor, because it's the poorest of the poor who end up in homeless shelters. Well, what's a measure? Remember, and I want to measure that is tied to a policy variable. I want to be able to tie it to something. I want to say to a policymaker, do more of this or less of that. So I want to look at a policy variable and that is a measure of the income of the poorest of the poor. And I'm going to use the social assistance income paid to what's known as a single employable, someone who's able to work but has no dependents. And I'm going to compare that to the cost of renting a one-bedroom apartment. And just as I said this morning, if you want to use a bachelor apartment, you get much the same result. So that's my housing affordability index. Okay, I unfortunately didn't bring it, but it came up at lunch. So I'll just tell you now that Rita has created a series that goes back to 1990 that shows this measure back to 1990. She's done it for every major city in Canada, so we will publish this soon. And it shows that back in 1990, someone like this, a single employable, actually could pay rent on a one-bedroom and still have 50% of his or her income left over in 1990. Now, no way. No way. It's just gone like that. I should have brought the graph, but really the graph looks like this. That's all that happened. It just goes down. And so affordability has just absolutely plummeted over time. Okay, so there's a graph. So remember, we've got data of 51 cities. Okay, so this is just the big 9. Yes, 9 cities. And the big 9 cities have about 75% of all shelter beds in Canada. Okay, so these are the big 9. And what I've got here, you've seen this morning, along the horizontal axis, as I move in that direction, housing becomes more and more affordable. So as you can see, Quebec City, over at the far right, has very affordable, the affordability index is very high there. Calgary, very unaffordable. Edmonton's pretty unaffordable too. On the vertical axis is number of shelter beds provided in that city. Calgary provides a whole lot of shelter beds per 1,000 people, but it also has a very unaffordable housing market. And you can see there's a pretty solid relationship there. If I just run that red trend line through there as an R squared, that's the thing that excites economists, at 0.6 is pretty high. But remember, I'm not even trying to control for other things, because lots of things affect the number of shelter beds a city's going to want to provide. This is one of them, but weather is going to be another one. So if you compare, look at Vancouver's down low, they provide relatively few shelter beds, but remember, it's warm in Vancouver. If you give Vancouver Calgary's weather, move Vancouver's dot up, they would find, and I'm going to show that to you in a second, Vancouver would find it necessary if they had Calgary's weather or Edmonton's weather, basically the same, except we're sunnier and we're nicer. Just kidding. If they had our weather to deal with, they would provide more shelter beds, and it would be closer to the red line. And so the relationship with housing affordability would be even stronger, which is why we actually want to do a more sophisticated statistical analysis than simply drawing a graph. But this gives you an idea of where we're going. And just that simple graph, I remember when Rita brought it to me, I went, holy smokes, I had no idea that you were so right, because she was convinced this would work and I wasn't. And she was right. It's really close. Okay, but we do need to, there's other things that are going to affect the decision by a city about how many beds to provide. So other things to consider would be the fraction of your population which is Aboriginal, because, or if they're recent immigrants to the country, because those demographics tend to suffer housing discrimination. And so the greater the size of those populations, the more likely it will be, perhaps, this is our hypothesis, that you might have to provide more shelter beds. Otherwise, you'd see them on the street. Winter temperature, I already talked about. If it's really, 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 really cold in your city, you're probably going to find it necessary to provide more shelter beds. And strong evidence of that, I remember in Calgary a few years ago, we had a brutally cold winter, and the city went around opening up empty warehouses to put homeless people in it because they were scared to death of people dying on the street. So there's a clear connection here between coldness and the preference for city agencies or city governments to provide more shelter beds. So how do we prove that? Well, we collect a whole bunch of data, and there it is. This is for the economists in the room. This gets them excited. So this is a regression coefficient, and what it says something pretty sensible. It's trying to relate the number of beds per person, that's beds over pop, okay, as a function of my key variable, social assistance income, SA, relative to rent, the number of the size of your aboriginal population, and January temperature. Okay, and so you can put this in the computer, run a regression. Okay, and out comes some results. Here it comes. There it goes. And so those numbers now are the coefficients, and because I was afraid of putting the economists in the room over the top, I didn't put standard errors in there because that would really get them excited. But they should know that all of those coefficients are statistically significant, okay, which means they mean something. Okay, so what do they mean? What do those numbers mean? They mean the following. It says that colder cities find it necessary to provide more shelter beds. Not surprising. Although I was surprised by the strength of the response. So, sorry, I didn't write it down, but my if memory serves, because Rita just gave it to me the other day, if Vancouver had Toronto's weather, they would have to offer about another 700 shelter beds than they do. Okay, so weather really matters. And maybe that's not too surprising, that should. The colder it is, the more beds you're likely to provide to keep people from being killed, basically. Cities with larger indigenous populations find it necessary to provide more shelter beds, although that's a fairly weak measure. It's statistically significant, but it's not all that big. It's not all that important. The big one is my last one. Falling rental affordability results in cities finding it necessary to provide more shelter beds. So when it becomes more and more expensive to rent, a city finds it necessary to provide more shelter beds. Question is, how sensitive is it? Is this sensitive? So our estimates, and the reason for doing all this is not just to get the direction of change, but to get a number so you can actually measure just how sensitive things are. Our estimates suggest that if we could increase the social assistance income provided to a single employable by $1,500 a year. Now remember, we're using data from 2011, so that would have meant increasing the income from $7,200 a year to $7,200 plus 15. $8,700 a year. Then, across Canada, 2,797 shelter beds could have been closed. That's 20% of the total. But remember, I'm only targeting those beds that are being provided to people who are in a shelter because of economic reasons. Only one-third of the beds are for people who are there for personal reasons. So if I just focus on the number of beds that are for economic reasons, I'm closing about a third of all shelter beds in Canada by providing an increase, that size increase in income to those labeled as a single employable by the social assistance program. In Calgary, that would be 353 beds, or 22% of the total. In Edmonton, 210 beds that could be closed by simply increasing the income of those labeled as a single employable. There's a policy that you could do. And it's a nice policy to do because if you look at the data, $1,500 is not all that much. particularly since really what it means is $1,500 means making up for the fact that the real value of social assistance payments whittled away by inflation. It would simply make up for the loss of what economists call real income, inflation-adjusted income, that has been suffered by this group over the last 10 years. So really, it's just kind of catching up. If we can go back to where we were 10 years ago, inflation-adjusted reasons, we could close 33% of the relevant shelter beds. Yep.
Does this data include domestic violence shelters or only homeless shelters?
Just homeless shelters, just emergency beds. I'll double check that, but I'm pretty sure that's true. Here's another policy. We could provide a rent subsidy or increase the rent subsidy by $100 a month, because that's the other way of doing it. Either give people more income or reduce their rents. If you did that, we could enable cities across Canada to close 2,426 beds, or 17% of the total. In Calgary, 236 beds, Edmonton, 148 beds. And again, some of these I find attractive policies because they don't involve huge outlays for the government. These are not, yes, they are expensive, but they're not unbelievably expensive. Certainly they pale by comparison to building housing by the government. Even more responses. Remember, anything that affects my affordability index will play a role here. So we could revisit density regulations. This is where cities come in, because that, I think, affects the affordability of low-end housing. We can incent the private sector to build more affordable housing, and I really think this is part of the solution too. And there's all sorts of ways of doing that. If you'd like to read about 30 of them, read the paper by Marion Steele and Peter Tomlinson that the School of Public Policy released about 5 years ago. Okay, they're all different ways, and none of them are terribly sexy or anything, but they're just little wee policy changes that can dramatically affect the cost of a private builder to provide affordable housing. And these are very effective ways of doing it. Still more options. Recall my presentation this morning where Calgary closed all those single-room occupancy hotels. So here's another policy: stop destroying the houses where poor people live in. And that includes trailer parks. Calgary's been busy closing trailer parks. Well, this is where people with straitened circumstances sometimes live. Stop closing them. Guaranteed annual income, I talked about that this morning. I think that's a good idea. But none of this should say to take away from the need for build public housing as well, because that's also got to be part of the solution, if only because my solution is simply giving people more income so they could afford to buy a rental accommodation is not going to be a good policy solution for those who need wraparound services and closer levels of care. I'm only talking about the 2/3 of people who end up in shelters who are there because of economic circumstances rather than personal circumstances. That's it. There's lots of ideas in there. I haven't done much with this. All I've done is identified that variable, the SA over rent, really matters. And there's lots of ways of attacking that number. And I think they should be attacked in many, many, many different ways. And the other contribution is to get some idea just how effective that is. Thank you.
All right, so we actually have a few minutes for some questions, about 8 minutes. So, any questions out there? One there. No, yeah, use the mic, please. There are people on webcast, watching this from their computers.
I have a very loud voice, so you don't want to scare. Okay, am I good? Clear? Thank you. I think I have a new fascination for data. My question is in regards to the social assistance and the increase to meet, to basically be able to afford housing. My question is, if we increase social assistance, I feel that in some ways it does not promote individuals to move away from the system, because for some, social assistance very much needed for, I think we can all agree, for many different reasons. But then there are others who are also on the system that could be doing, could be guided to do more to come off the system. And there's reasons for why people are on it and so on, the length of time. But I think that if we increase the social assistance system, how does that promote individuals to move away from that? Because social assistance should never, ever be treated, and I don't like to use the word never, but it should never be treated as a permanent source of income, only for some. And so there's certain demographics that I could see why, but I guess that's just kind of my question. How does that look in the bigger picture?
Okay, well, I went back to this slide because I'm showing you the number here of the income level that we're talking about here, $7,200. I'm talking about increasing it to $8,700. This is not a lifestyle choice. This is destitution. Okay, and so I'm not advocating. Well, 2 points. I'm not advocating pushing this up to levels that are going to threaten anyone who actually works for a living to say, geez, I'd rather be on social assistance. We're talking pretty low level of income. And I was going to follow it up with another point that's gone right out of my head. I guess that's the big one. If it comes to me, I'll blurt it out later.
Hello. I have a question, but that got me thinking then, I don't think you learn to swim while you're already drowning. That's just true. You know, I think they need the help to get out, but there are those barriers, right? Why is that, and how are you going to get past that? Like, I'm asking for your opinion right now. Like, there are some people who just kind of say like, don't give them free money. But like, how do you convince people to see it, I guess, apart from slides?
Well, I'm not sure. Well, first of all, that's how I did learn to swim. My brother pushed me in the deep end, and that's how I did learn to swim, by drowning. But so I'm not sure what the question is. I'm trying to. All I want to do is try to, and I want to emphasize this: $1,500 is not a huge amount. It's really just really raising that income back to where it was 10 years previously, before inflation was allowed to eat away at it. So I'm not providing this at a level that's a lifestyle. It's just enough to try to keep you from drowning. That's all I'm trying to do. The other, again, about the guaranteed annual income is, if it were up to me, I'd push it higher than that. I'd be talking about guaranteed annual income. And I'd be talking about guaranteed annual income of about $15,000. Why $15,000? Because we have a guaranteed annual income in Canada at that level. We pay it to seniors. And I don't know what's magic about age 65. And we've done some really cool studies. Well, cool until you think about what you're talking about. We've done some nice studies that show how food insecurity amongst the very poor falls at age 65. And why is that? Because they start receiving the guaranteed income supplement and they have a guaranteed annual income. So although I'm only suggesting $1,500, I'd actually go higher than that.
My breakpoint was going to be $1,500 is $60 extra per paycheck.
Yeah.
And when a bus pass is $89 and the price of groceries is increasing, that's really not that much.
But in some sense, the surprising thing is you get such a big bang for your small buck. It's not that big of an increase in income, and yet I'm closing 20% of shelter beds. And again, remember, the beds I'm closing are the ones that are being provided to people who come and stay in the shelter for just a couple of nights and then they're never seen again. And those sorts of people take up a lot of shelter beds.
I guess my question is, I think this is really interesting, and again, I think $1,500 is not a lot. I'm wondering if you've looked at the cost comparison between that $1,500 a year increase and the savings like per bed that you're closing, like how much overall savings that is to the system as a whole?
Great question. It turns, I'm going from memory here, but we have looked at exactly that. Is this going to be cost effective? Well, it depends on what you consider a cost. So rough numbers, so we can measure how much benefit comes to the government from closing shelter beds, roughly $50 a night per bed. So I can do that multiplication and say, well, I've saved that much money for the government. But of course, I'm also giving $1,500 a year to every single employable in Alberta, and there's about 40,000 of those. I could be wrong, but there's a bunch of them. And so you can actually calculate that. It turns out it's more expensive to pay the $1,500 to the single employables than the money you save from closing the shelter beds. However, that doesn't take into account the other benefits, the difficult to measure benefits of getting people out of the shelter system, which I think are enormous, and some of which have been talked about, that Brian talked about, that there's going to be savings to the police and legal system, there's going to be savings to the healthcare system, none, all of which have to be rolled into it. And when those results come out, I'll be able to give you a better measure of the cost benefit of this stuff. So I'm anxious to see that. Hurry up.
All right.
Okay. Thank you.
Thank you, Dr. Kneebone, for that. Thank you for those great questions.